And with that, I'll be introducing the session, our session, to you. In this session, we'll be listening to Dr. Rizka Ayu Setyani, and Dr. Rizka will be talking to us about the topic on integrating public health services for maternal and child health in Indonesia, strengthening connection. I'd like to introduce Dr. Rizka to us by reading through our bio. Dr. Rizka Ayu Setyani, SST, MPH, is a midwife, researcher, and health advocate. She has a strong background in public health and maternal child health. She serves as an assistant professor and midwife practitioner. Rizka has been actively involved in various research and community service projects, focusing on HIV/AIDS prevention, digital health interventions, and maternal well-being. Our contributions extend to the development of innovative programs such as Sekochi, Secular Complementa Sinta Ibo, and GIMIS, Youth Movement for Literacy Awareness. She has received numerous awards, including the Satu Indonesia Award and recognition as an emerging voice for Global Health Fellow. Rizka is also a prolific author with multiple publications in national and international journals, and a frequent speaker at global health conferences. Our dedication lies in bridging research and practice to improve healthcare systems, particularly for underserved populations. Ladies and gentlemen, please join me to welcome Dr. Rizka Ayu Setyani. Rizka, over to you.
Okay, thank you, Professor, for the wonderful opening slides. And I want to share the studies. Thank you. Also, you can move the slides control with me. Good morning, afternoon, evening, everyone. My name is Rizka, and I'm joining you from Indonesia. It's truly an honor to be part of this free IDM session today. I think it's 4 times I joined VIDM as a facilitator and speaker, and where I will be sharing insights on the integration of primary health services for maternal and child health in Indonesia. This integration plays a vital role in addressing persistent gaps in healthcare access and in improving outcomes for mothers and children throughout the country in Indonesia. Today, we will explore how strengthening these connections within our health systems can pave the way for a healthier, more equitable future. So let's get started. Okay, maybe I have some issue in technical in the slides. Okay.
Are you okay, or you would like me to?
Maybe I can I cannot move the slides, but it's okay. Maybe well at time.
I think you've moved. Are you?
Okay, is it not move?
It has, yeah.
Okay. It's not move. Okay. Okay, sorry for the issue. So I can move the next slides. So we can start off the introduction of the slides. Yeah. Maternal and child health remains a critical public health issue in Indonesia, despite the many efforts
sharing the screen. Are you the one sharing?
No, it's Rizka, and she's on the next slide that she's talking through.
Yes, I control my slides. Is it clear for you from you?
Yeah, I can see it well. Can we all see the slide, please?
Yeah.
Okay. Maybe
Okay.
you make the host.
Please go on, Rizka.
Okay. Okay, I want to continue my presentation. So these slides tell about the maternal and child health remains a critical public health issue in Indonesia. Despite the many efforts to improve healthcare services, we continue to face challenges such as the high maternal mortality rate, which remains around 260 deaths per 100,000 live births. Neonatal mortality rates are also a major concern. One of the primary reasons for this issue is the fragmentation of healthcare services, especially in rural and remote areas, where over 40% of villages still do not have access to a midwife. This lack of connectivity in healthcare services creates significant barriers to access for mothers and newborns. A solution to these challenges lies in integrating primary healthcare services, which involves linking midwives, community health workers, and health centers to provide seamless and continuous care for mothers and their children. And the objective of our study is to evaluate the effectiveness of an integrated primary health care model in improving maternal and child health outcomes. A particular focus of our research is on midwives, who serve as key facilitators in the integration of healthcare services. In Indonesia, midwives are essential for maternal and newborn care, but they face several challenges, such as limiting training, insufficient supervision, and inadequate infrastructure. By strengthening the role of midwives and integrating healthcare services, we aim to bridge the gap in healthcare access and improve health outcomes for both mother and children. And to conduct this study, we adopt a mixed methods approach across 10 primary healthcare facilities, including both urban and rural regions. We perform quantitative analysis by reviewing patient records and service utilization data, focusing on antenatal and postnatal visits. In addition, we gathered qualitative insights through interviews and focus group discussions with midwives, healthcare workers, and families. This approach allows us to measure both the efficiency of the healthcare services and the community's perceptions of maternal and child healthcare. And these slides, we also have our key findings our findings revealed significant improvements in maternal health services after the integration of primary health care. The first findings, antenatal care visit increased by 30%, which means better monitoring of maternal health throughout pregnancy. Postnatal follow-up rates improved by 25%, reducing complications in the postpartum period and ensuring that mothers receive the care they need after childbirth. And the last findings, the referral systems between healthcare providers were strengthened, leading to quicker intervention for high-risk pregnancies. These improvements show the positive impact of integrating healthcare services in improving access and quality of maternal and child healthcare in Indonesia. And midwives are the backbone of maternal health care, and the integration efforts have further reinforced their role. Collaboration between midwives and community health workers has been enhanced, allowing for more effective home visits and early interventions. Trust between families and healthcare providers has increased, leading to higher rates of service utilization and better outcomes. And however, midwives still face challenges related to inadequate training, limited research, and uneven distribution, with many moving from rural to urban areas in search of better opportunities. To fully maximize their potential, there is a need for additional capacity building efforts, including more comprehensive training and better support systems. And the key findings of digital innovation also have played a crucial role in improving healthcare integration. The use of electronic medical records has helped reduce delays in service delivery and improve coordination among healthcare providers. Real-time maternal health monitoring has enabled faster response to complications, improving maternal outcomes. And telemedicine services in rural areas have allowed for remote consultations with specialists, overcoming geographical barriers and improving access to expert care. So by emphasizing and expanding digital health innovation, also interoperability, we can further enhance maternal healthcare delivery across Indonesia. Our research contributes directly to Sustainable Development Goals 3, which focuses on ensuring good health and well-being. Specifically, our findings support the goal of reducing maternal mortality rates, contributing to Indonesia's target of lowering deaths to less than 70 per 100,000 live births by 2030. Improving neonatal health outcomes, ultimately reducing preventable newborn deaths. And finally, expanding this integrated model nationally, which would bolster Indonesia's Safe Motherhood initiative and ensure that all mothers and children, no matter where they live, have access to the care they need. We also have 3 recommendations of the research implication. To sustain and expand these improvements, we propose 3 key recommendations. There are, first, expand integrated primary health services to reach more rural and underserved areas where healthcare access remains limited. And the second one, strengthen the roles of midwives by offering enhanced training, mentoring, and policy support, ensuring they can continue to provide high-quality care. And finally, continue to invest in and expand digital health innovation, such as telemedicine, to facilitate continuous monitoring and rapid response in maternal and child healthcare services. So by implementing these strategies, we can work towards achieving equitable healthcare for all mothers and children across Indonesia. And the last but not least in the slide, in conclusion, integrating primary healthcare services is a critical step in improving maternal and child health in Indonesia. Midwives play a key role, potential in ensuring that healthcare reach every mother and newborn. But without stronger policies, better training, and improved infrastructure, we risk leaving vulnerable populations behind. I urge policymakers, healthcare providers, and global health organizations to support and scale up this successful integration model. Let's work together to ensure that no mother or child is left behind. Thank you for your attention, and I look forward your comment and question. Thank you so much. Thank you, Professor Adi.
Thank you so much, Dr. Rizka. Very insightful discussion there. Thank you so much for that wonderful presentation, where you have told us about the implications of service fragmentation, especially as it relates to maternal and child health for people living in rural and remote areas, and how digital innovations can help to reduce those disparities that can come, as well as the inequalities in terms of access to services, not only access to services, but then also in terms of the health outcomes. Thank you so much. Please, I want to implore us all, the audience, to please remember to type your questions in the chat. And if you think you feel you want to maybe speak or ask the question directly, you can raise up your hand and I will give you the opportunity to ask your question. While you are getting ready to ask questions using the chat box, I will ask Dr. Rizka some questions, if you don't mind, Rizka. I think the very first one is to ask about what you think in terms of how midwives can be empowered, as change agents in the integration of primary health care services. And alongside that, if you don't mind expanding a bit more on what the systemic barriers might be in terms of midwifery leadership. Thank you. Over to you, Rizka.
Okay, thank you, Professor Adi, for your questions. I will to answer your question. Maybe how can midwives be empowered as change agents in the integration of primary healthcare, especially in Indonesia, and what systemic barriers might hinder their leadership? Actually, in Indonesia, midwives play key power or key person as a person in primary healthcare. So empowerment can occur through continuous training, leadership roles in community health planning, and also collaboration with community health workers is also important. It's very important. So I think policymakers can make this system smoothly, and also policy advocacy. Also barriers include hierarchical systems, limited authority, and also resource limited, lack of the knowledge of the all midwife is not really challenges. But I think in Indonesia and also and around the world is important to know how to improving the knowledge, how to improving the skills, and also how to improving the strength of the policy advocacy. Maybe is that all? And we can collaborate together and making connection each other.
Thank you. Thank you so much. While we're still waiting for others maybe to ask questions, I can see comment from Noah saying thank you so very much, Dr. Rizka, for your presentation. I think let me quickly ask another question, and that is, I know you talked about
Thank
it
you.
all.
Nuha, also my friend, and also Wahyu, Akwartuti, from Indonesia is my PhD friend.
Oh, that's
from
good.
Universitas Blas Maret. Thank you so much for attending.
Thank you so much. And Alida has said, thank you so much for your presentation. Great work. While we're still waiting for people to ask questions, let me ask, I know you talked about it already, but then I was thinking, are there other ways, are there other solutions that we can use to address fragmentation of services? Apart from the ones that you described earlier, are there other solutions that we can implement? Thank you, Rizka.
Yes, thank you, Professor Ade. Actually, fragmentation may lead to delayed referral.
I think somehow we've lost Dr. Rizka. Rizka, are you still there? Yeah, so I will just talk about maybe like other possible solutions. Okay, yeah, she's back. Go on.
Okay. Sorry,
For a
I
bit there.
have
It's
the
okay.
technical issue. Yeah, my connection is lost, and maybe I want to answer your question about.
Don't forget to effect decoration, right?
So,
Yeah.
Alima, if you don't mind muting, we can hear your some background noise from your end. Thank you.
Thank you.
Go on, Rizka. Thank you.
Okay. Thank you, Professor Ade. About your question, about the fragmented health services affect maternal and child outcomes. Actually, fragmentation may lead to delayed referrals, poor follow-up, and duplication of services. In Indonesia, solution may include mobile health units, but I think the fragmented the data is also challenging. So integrated digital referral systems and interoperability system to move the data not in fragmented system, but also in integrated each other. So empowering local cadres to bridge service gaps is very important to connecting each other and also improve the health system, especially in Indonesia. So I think it's the answer, my answer. Thank you.
Thank you so much. There are lots and lots of positive comments in the chat, all congratulating you and showing appreciation for your presentation.